Welcome back. So, in this one page series, I've tried to cover a topic in a single page. And let's go. So, here there is levodopa. Levodopa is converted to dopamine. And this levodopa, it is able to cross the blood-brain barrier. And this conversion of levodopa to dopamine is with the presence of decarboxylase enzyme. Dopamine alone cannot be crossing the blood-brain barrier, so levodopa is administered. And as we all know, it is mainly used in case of Parkinsonism. And looking at the adverse effects, in case of GI tract, it can result in nausea, vomiting, as well as anorexia. Now moving to the CVS, it can result in postural hypertension, tachycardia, palpitation, as well as cardiac arrhythmias. Now, other adverse effect, it can lead to dyskinesia, which is nothing but involuntary movements, which includes tics, tremors, and choreoathetoid movements. And it can also lead to mental changes such as confusion, delusion, hallucination, and also results in taste, which is change in taste. And moving ahead, levodopa can be given with carbidopa or benserazide with a fixed dose combination. So what this fixed dose combination does is that it increases the T-half, increases the bioavailability, and also it has a good compliance, and it decreases the gastrointestinal effects such as nausea, vomiting, and decreases the CVS effect such as tachycardia, hypertension, and cardiac arrhythmias. Thank you.